With a state of emergency declared March 17th, many workplaces were either closed or operating at a reduced capacity and with limited staff. The release of the public health directive shortly thereafter may have suggested workplace joint health and safety committees had no further role to play. So much has changed in the past 3 months, the legal requirements for a joint health and safety committee or health and safety representative has not. In fact, with workplaces responding and workers returning to work, the role of the committee and the representative is much more important now than ever. Hello, I am Kim Marshall, Training Service Representative with the Workers' Health and Safety Centre. As Ontario's designated health and safety training organization, we deliver a wide range of classroom and now virtual training courses to assist in making your workplace healthier and safer. This webinar is one in a series we're developed to help you to stay safe throughout the pandemic. A video of this and all our other webinars get posted to our YouTube channel, WHSC Training. And this PowerPoint will be posted on our website by tomorrow. You will get a follow-up email tomorrow morning giving you the exact links. Today's topic is on role of the Joint Health and Safety Committee and Health and Safety representatives in preventing COVID-19. This webinar will focus on powers and functions of the Joint Committee and representatives, inspecting the workplace for COVID-19 hazards, making recommendations regarding COVID-19, investigating and reporting incidents of COVID-19, assisting in work refusals, participating in MOL inspections, employer duty to assist committees and representatives, role of the certified members, a COVID-19 safety plan. Joint committees play a critical role in ensuring workers have a voice in identifying, assessing, and controlling, and hopefully eliminating the hazards in the workplace. This includes the hazard posed by the exposure to the virus causing COVID-19. Generally, Ontario Occupational Health and Safety Act requires a joint committee in workplaces where 20 or more are regularly employed. There must be at least 2 members of the joint committee, one selected by the workers, another by management in a workplace regularly employing less than 50, and a minimum of 4 members in workplaces over 50. Whatever the size, at least half the joint committee members must be workers who have no managed role in the workplace. On a construction site, the law includes an added component, a worker trades committee. A worker trades committee is required to ensure concerns from workers on all parts of the projects are being heard. But no matter the industry, any joint committee must be co-chaired, with one co-chair representing the workers and the other representing management. And the joint committee must meet at least once every 3 months. So, if your committee hasn't met since March 25th, your workplace is not in compliance with the law. In workplaces between 5 and 19 are regularly employed, only a worker health and safety representative is required, not a committee. But as you'll see, health and safety representatives have many of the same powers and functions of this Joint Health and Safety Committee. The Occupational Health and Safety Act assigns powers and functions to the Joint Committee. It's the Joint Committee's job to identify hazards, make recommendations, and get health and safety information from the employer. The Joint Committee should be in place where employers and workers have discussions about how to prevent injuries and illnesses, including preventing outbreaks of virus causing COVID-19. Those powers and functions are written down in subsection 9(18) of the Act, and many are important to fighting against workplace outbreaks for health and safety representatives. Similar powers and functions are set out in subsections 8, 10, and 11. The Act gives joint committees and representatives the power and function to identify the situation that may be a hazard to workers, which can include a lack of cleaning and disinfection, lack of physical distancing, and a lack of masks. Not having health screen checks for workers returning to the workplace after an illness can be a hazardous situation. The Act allows a joint committee to get information from the employer about the hazard. If the employer has information that identifies a potential COVID-19 hazard related to material, process, equipment, or joint committee, or rep is entitled to receive it. If the employer has information on health and safety experiences and work practices or standards in similar workplaces, the Joint Committee has the right to have it to help in their work. If the employer has information about conducting tests on any equipment, machine, process, and significantly any biological, chemical, or physical agent in the workplace, the committee or rep is entitled to it. Remember, the virus is a biological hazard, so workplace COVID-19 testing is likely captured by this requirement. And if there is testing, the Joint Committee needs to be consulted about it, and a worker representative from the Joint Committee present at the beginning of workplace testing. And very importantly, the Joint Committee and reps in smaller workplaces also have the power and function to make recommendations to the employer to improve COVID-19 safety. And remember, the Joint Committee can't just block recommendations from coming forward if the worker side has made in good faith effort to reach a consensus on a recommendation. And in this situation, the worker co-chair can directly make a recommendation to the employer. An employer has a duty to respond back to any recommendations of the Joint Committee or representative, and response needs to be made within 21 days. If the employer agrees with your recommendations, they need to give a timeline on and when it will get done. So, if your Joint Committee or representative recommends better cleaning and disinfecting, and the employer agrees, they have 21 days to tell you they're going to do it. If the employer disagrees, they need to give you a reason. Remember that the employer has a legal duty to take every precaution reasonable in the circumstance for the protection of the worker. So just saying no because it would cost too much money or take an effort isn't reason enough to disagree with the recommendation. Though, if it is a price tag or the effort is unreasonable, it would be. A lot hinges on what is reasonable. During this pandemic, we've seen many situations in which worker voices were ignored, allowing tragedy to follow. A crisis doesn't mean joint health and safety committees are suspended. In fact, this is exactly when they're needed the most. A joint committee offers a pathway for workers to raise the concerns and make recommendations. And really important, a worker, joint health and safety committee member, or health and safety rep also have the right of monthly inspections. Inspecting the workplace for places and situations where workers may be exposed to the virus is the first step in controlling the hazard. During the pandemic, workplace inspections can focus on locations where workers are working close proximity to each other, locations where workers interact regularly with clients, situations where workers are handling product that have been touched by consumers. A new Workers' Health and Safety Center design inspection checklist has helped the Joint Health and Safety Committee members inspect workplaces to protect from COVID-19, was the topic of last week's webinar. You can download the inspection tool from our website. Once the Joint Committee understands where and how may be exposed to the viruses, measures to eliminate or control transmission can be established. As an occupational illness, COVID-19 is subject to the same Joint Committee investigation and reporting requirements as other occupational illnesses. If the worker contracts COVID-19 in the workplace, it is an occupational illness. As of June 12, 2020, WSIB has received 4,578 claims of COVID-19 occupational illness and another 2,667 reports of COVID-19 exposure incidents. If an employer is advised on behalf of a worker who has contracted COVID-19, the claim for occupational illness has been filed. The employer must report to the Joint Committee as well as the Ministry of Labor and the union, if applicable, within 4 days. A confirmed case of COVID-19 must also be reported to the local public health unit. This is a critical step to avoiding a cluster. Public health are responsible for case tracing that identifies anyone who may have been in contact with the infected person and getting them tested, and if necessary, isolate. Reporting the case to public health isn't a Joint Committee responsibility, but it is certainly something the Joint Committee might want to address if it hasn't been done. And if there is a workplace COVID-19 fatality, worker members of the Joint Committee or Health and Safety Representative are entitled to investigate. Joint Committee members play a critical role in refusals. If a worker is refusing because of the concern for COVID-19 transmission, the obligation is to report the refusal to their supervisor. And the supervisor's first duty is to investigate the worker's concern in the presence of the worker member of the Joint Committee or workplace representative. If the work refusal isn't resolved, and while waiting for the MOL to investigate, the employer can assign worker to do the refused work. But there are limits. And again, the Joint Committee or representative must be involved. For example, if a worker refused to travel in a work truck where another person they believed had been exposed to COVID-19 virus, and the MOL had been called in, the employer can assign another work to replace the refusing worker in the truck. But the replacement worker needs to be told about the refusal and the reason, and must happen in front of the worker member or the Joint Health and Safety Committee representative. We've developed a flowchart and checklist to the tool to help the worker, Joint Health and Safety Committee members, and reps ensure any refusal is done in compliance with the Occupational Health and Safety Act. In our Certification Part 1 course, we show participants how to use this tool, and you can also download this from our website. If a Ministry of Labor inspector comes to the workplace for refusal or any other reason, the Joint Committee can be involved in that too. The Act requires that an employer must give a worker member of the Joint Committee or rep the opportunity to accompany the inspector during his or her physical inspection of the workplace or any part of. Keep in mind, the inspector's order or lack of an order can be appealed to the Ontario Labor Relations Board. But that's sort of a legal challenge. While it might involve worker Joint Committee members, is something the union would decide on if there is one. Joint committees and representatives aren't an add-on or an option. They're central to the internal responsibility system of the workplace. They have legislative powers and functions, and the Occupational Health and Safety Act says employers must assist the Joint Committee and reps to carry them out. If the employer has any health and safety reports, the Act requires the workers be informed about them and the results reported and shared with the Joint Health and Safety Committee or representative. If the report is in writing, the parts of the report about the Health and Safety Act need to be provided to the workers. If there is an MOL inspection, the employer must allow a worker Joint Health and Safety Committee member or representative to accompany the inspector. If there is a refusal, they must permit the Joint Health and Safety Committee member or representative be present for the investigation. The Act also requires the names of the Joint Health and Safety Committee member to be posted in the workplace. So during the pandemic, the Joint Committee can be and is an important place to figure out how to protect workers and make sure the employer supervisors are carrying out their duties. The Act requires that most workplaces with a Joint Committee have 2 committee members, 1 worker, 1 manager, who have completed training courses that qualify them to be a certified member of the Joint Health and Safety Committee. And if your workplace isn't compliant with certification training requirements, we have certification training running constantly. Register on our website or speak to one of our representatives. Certified members get additional training that benefits the Joint Committee, but they also have legal roles that are important during the pandemic. The Act says some of the roles are reserved for certified members only, so-called mandatory roles. Other roles can be filled by the other Joint Committee members, but the law says the role should be done by a certified member if possible. These are called the preferred roles of the certified member. There are 2 Joint Committee functions that the Act prefers to be done by a certified member. The first is monthly inspections of the workplace. The Act states monthly inspections should be done by a certified member if possible. The second preferred role is when the employer reassigns work during a work refusal. We've had an example of a work refusal in the travel truck with someone they believe had been exposed to COVID-19, and the MO has been called. If the employer does assign another worker to that truck, the replacement worker needs to be told about the refusal and the reason in the presence of the worker of the Joint Committee. And the Act says the Joint Health and Safety member should be certified if possible. The roles can be undertaken only by a certified member related to work stoppages, which can be used to protect workers from exposure to COVID-19 virus. A work stoppage is about preventing anyone getting hurt from a so-called dangerous circumstance. It's a situation when a provision of the act or regulation being contravened, the contravention poses danger or hazard to a worker. Any delay in controlling the danger or hazard may seriously endanger a worker. Dangerous circumstances exist when all three criteria are met, and when they are. A certified member's first step is to raise concern in the workplace with the supervisor. But if the certified member continues to think that a dangerous circumstance exists, and if the two certified members, a worker and manager representative, agree, they can jointly direct the employer to stop the use of any part of the workplace of the equipment, machine, device, article, or thing. If the certified member doesn't agree, either member can call the MOL to investigate and decide. Like a work refusal, the certified member's work stoppage is limited to some situation for workers. This is the case law and few labor board decisions about certified members using work stoppage. So we don't have a lot of interpretation about how the power can be used, particularly in the situation of a pandemic. The ability was given as a last resort in emergency situations. But a dangerous circumstances could exist if, for example, a worker was required to work closely with a person confirmed or suspected to be infected with the virus. Keep in mind, law limits the stop work direction to part of the workplace of any equipment, machine, device, article, or thing. We developed a work stoppage flowchart and checklist to help Joint Health and Safety Committee members. It is discussed in our Certification Part 1 course and can be downloaded from our website. It is under Health and Safety Documentation Tools. Most employers are required to have a written posted health and safety policy. They are also expected to operate a program of workplace activity to carry out that policy. With the emergence of COVID-19, that program might now be included in the activities like cleaning and disinfecting, distancing, use of PPE, and other controls. And functions of the Joint Health and Safety Committee to recommend the establishment, maintenance, and monitoring of the programs, measure procedures respecting the health and safety of workers. If the employer doesn't have a COVID control plan, it is the Joint Committee's function to make the recommendation about developing and then implementing one. In addition to the series of webinars on COVID-19, the Workers' Health and Safety Center is now offering virtual classrooms. While modified, a number of our most popular programs such that they can be delivered by a virtual classroom. Recently, we added a course on hazards posed by the virus caused by COVID-19. You can register for any of our programs by visiting the website. You can also follow the latest developments, including any new or revised programs via Facebook or Twitter. If you want to download a copy of this presentation, you can get it from our website if you want to watch the webinar again or send it to someone by tomorrow. By tomorrow, you can find it on our YouTube channel, WHSC Training. You will receive a follow-up email tomorrow morning with exact links. You can also follow the latest developments via Facebook or Twitter. Let us know how we did today by completing the poll posted on your screen. Let's take some questions. I'm a certified member, and at my workplace, which is reopening, should I be asking the employer for the access to the site before we return to work to complete an inspection for COVID-19 hazards? Yes, this is a great idea. Inspections are Inspection to identify where and how workers may be exposed to the virus should occur before workers return to the workplace. That way, precautions, whether it be installation of hand sanitizer dispensers or rearranging of workspaces for physical distancing, would be in place to protect the workers when they return. Hopefully, your employer will welcome your offer, but the Act says inspections by Joint Health and Safety Committee members or representatives are required monthly and doesn't say the right is canceled in the pandemic. You talked about certified members doing a work stoppage. What if management certified member won't agree? A management certified member is the appointee of the employer who has duty to take all precaution reasonable in circumstances. Not stopping work, for example, where a presumed or confirmed case with COVID or someone exposed to COVID is in the workplace might not be reasonable. This is the point to be raised. But if the certified worker member can get the agreement of management certified rep to stop work, the worker can call the MOL. Obviously, won't be as quick, but suggested such a step might help. I'm on the Joint Health and Safety Committee, and it seems we can't get recommendations done. How does a single co-chair make a recommendation? Well, the co-chair must write up the recommendation and send it to the employer. But keep in mind, there are some limits on this in the law. There must have been a good faith effort that failed to reach consensus on the recommendation. This was put into law to try to overcome roadblocks or stop dysfunctional Joint Health and Safety Committees from stopping good recommendations. But the goal shouldn't be to try and end run avoid Joint Health and Safety Committee discussions. Keep in mind, in a smaller workplace, there is no committee, just a worker rep who can make recommendations anytime they want. Making recommendations is the function of the Joint Health and Safety Committee, and the employer has to cooperate and assist with the Joint Health and Safety Committee. Does the manager on the Joint Health and Safety Committee need to be from the workplace? No, the Act does not require it, but the Act says it is preferred. The Act says the employer appoints members to the Joint Health and Safety Committee who exercise managerial functions, and they should, to the extent possible, be managers at that workplace. Sometimes it's not possible, but management representatives should be from the workplace to the extent possible. Are workers entitled to joint committee inspections? Let's be clear. There are no inspections by the Joint Committee. The Act gives the workers member of the Joint Health and Safety Committee, preferably the worker certified member, the power to select a worker member inspect the workplace. It's their inspection alone. It's the worker's inspection. We at the Worker Health and Safety Center have always recommended that in usual circumstances, worker reps invite department supervisors to join them in on their inspection. A worker rep on inspection doesn't have workplace authority to tell someone to change something that's hazardous, but a supervisor can. If there's a good relationship in the workplace, bringing supervisors into an inspection can help the hazards get fixed faster, and we recommend it. But this is the Worker Joint Health and Safety Committee members' inspection, not a Joint Health and Safety Committee inspection. Okay, that's the time we have. Thanks for joining us today.